What is HIPAA compliance? A HIPAA certificate typically refers to a document awarded to individuals or organizations upon completing training programs focused on the Health Insurance Portability and Accountability Act, HIPAA. These certificates often signify that the holder has acquired knowledge about HIPAA's privacy and security rules, which govern the protection of patient health information. Official recognition of HIPAA certification. It's important to note that the U.S. Department of Health and Human Services, HHS, the agency responsible for enforcing HIPAA regulations, does not endorse or recognize any third-party HIPAA certifications. This means that while such certificates can demonstrate an individual's or organization's commitment to understanding and implementing HIPAA standards, they do not equate to official compliance. The HHS does not certify healthcare providers or their employees as HIPAA compliant. Purpose and benefits of HIPAA certificates. Educational value. Training programs provide valuable information on safeguarding protected health information, PHI, which is crucial for healthcare professionals. Professional development. Holding a HIPAA certificate can enhance an individual's credentials, potentially leading to better career opportunities in healthcare compliance. Organizational assurance. For organizations, having employees with HIPAA certificates can strengthen their compliance stance and demonstrate a proactive approach to data protection. HIPAA privacy rules. The privacy rule establishes national standards to protect individuals' medical records and other personal health information, PHI. It applies to health plans, healthcare clearinghouses, and healthcare providers who conduct certain financial and administrative transactions electronically. Examples of PHI or personal health information. Names. Geographic data. Dates. Phone numbers. Fax numbers. Email addresses. Social security numbers. Medical record numbers. Health plan beneficiary numbers. Account numbers. Certificate/license numbers. Vehicle identifiers and serial numbers. Device identifiers and serial numbers. Web URLs. IP addresses. Biometric identifiers. Full face photos and comparable images. Any other unique identifying number, code, or characteristic. Permitted uses and disclosure. Treatment, sharing PHI with other healthcare providers involved in an individual's care. Payment, disclosing PHI to health plans to get paid for services. Healthcare operations, using PHI for activities like quality improvement, training, and business management. Public interest and benefit activities, disclosures for purposes like public health activities, reporting abuse, and law enforcement, with specific limitations. Individual rights. Right to access. Individuals have the right to inspect and obtain a copy of their PHI. Right to request amendments. Individuals can ask for their PHI to be amended if they believe it's inaccurate or incomplete. Right to an accounting of disclosures. Individuals can request a list of certain disclosures of their PHI made by a covered entity. Right to request restrictions. Individuals can request restrictions on how their PHI is used or disclosed, though covered entities are not always required to agree. Right to confidential communications. Individuals can request to receive communications from a covered entity by alternative means or at alternative locations. Notice of Privacy Practices or NPP. Covered entities must provide individuals with a clear and accessible NPP that explains their rights and how the covered entity may use and disclose their PHI. Consent versus authorization. Consent, while often used in healthcare, the privacy rule generally permits uses and disclosures for treatment, payment, and healthcare operations without an individual's written consent. While authorization, for uses and disclosures outside of treatment, payment, and healthcare operations, e.g., marketing, research not specifically permitted, a valid written authorization from the individual is typically required. HIPAA Security Rule. The security rule sets national standards for protecting the confidentiality, integrity, and availability of electronic protected health information, EPHI. It applies to the same covered entities as the privacy rule. Key principle: risk analysis management. Covered entities must conduct a thorough risk analysis to identify potential threats and vulnerabilities to EPHI and implement security measures to mitigate those risks. Administrative safeguards. Security management process: developing and implementing security policies and procedures. Assign security responsibility: designating a security official. Workforce security: implementing security awareness training and access controls for employees. Information access management: establishing policies and procedures for granting and terminating access to EPHI. Administrative safeguards. Security awareness and training: providing training to all workforce members on security policies and procedures. Security incident procedures: developing procedures for responding to security incidents. Contingency plan: developing procedures for responding to emergencies, e.g. data backup and disaster recovery. Evaluation: periodically evaluating the effectiveness of security measures. Physical safeguards. Facility access controls: limiting physical access to facilities where EPHI is stored. Workstation use: establishing policies for the use of workstations. Workstation security: implementing physical security measures for workstations. Device and media controls: implementing policies and procedures for the disposal and reuse of electronic media containing EPHI. Technical safeguards. Access control: implementing technical policies and procedures for electronic access to EPHI. Audit controls: implementing hardware, software, and/or procedural mechanisms to record and examine activity in information systems that contain or use EPHI. Integrity: implementing policies and procedures to protect EPHI from improper alteration or destruction. Person or entity authentication: implementing procedures to verify that a person or entity seeking access to EPHI is who or what they claim to be. Transmission security: implementing technical security measures to guard against unauthorized access to EPHI that is being transmitted over an electronic network. Transmission security: implementing technical security measures to guard against unauthorized access to EPHI that is being transmitted over an electronic network. Organizational requirement. These involve business associate contracts and other organizational arrangements to ensure security. HIPAA breach notification rule. The breach notification rule requires covered entities and their business associates to notify affected individuals, the Department of Health and Human Services, HHS, and in some cases, the media, following a breach of unsecured PHI. Definition of a breach. A breach is generally defined as the acquisition, access, use, or disclosure of PHI in a manner not permitted under the privacy rule that compromises the security or privacy of the PHI. There are some exceptions, such as unintentional access by a workforce member within the scope of their employment. Risks assessment. The nature and extent of the PHI involved. The unauthorized person who used the PHI or to whom the disclosure was made. Whether the PHI was actually acquired or viewed. The extent to which the risk to the PHI has been mitigated. Notification requirements. If a breach is determined to have occurred, example, there is more than a low probability that the PHI has been compromised, specific notifications are required. Media notification. If a breach affects more than 500 residents of a state or jurisdiction, covered entities must also notify prominent media outlets serving that state or jurisdiction. Business associate notification. Business associates must notify the covered entity of any breach of unsecured PHI they discover. The covered entity is then responsible for providing the required notifications. Unsecured PHI. The breach notification rule applies to unsecured PHI, which is PHI that is not rendered unusable, unreadable, or indecipherable to unauthorized persons through the use of a technology or methodology specified by HHS. Encryption is the primary method for rendering PHI unsecured. Best practices for handling PHI or protected health information in remote setting. 1. Use secure communication channels. Encrypted email and messaging platforms that are HIPAA compliant, e.g. Powbox, Tiger Connect. Virtual Private Network, VPN, to access internal systems securely. Avoid using public Wi-Fi. If unavoidable, use a VPN. 2. Ensure devices are secure. Enable full disk encryption on all devices used for work. Use strong, unique passwords and enable multi-factor authentication, MFA. Keep operating systems, antivirus software, and applications regularly updated. 3. Limit data access and sharing. Apply the principle of least privilege. Only authorized personnel should access PHI. Do not share PHI through unsecure methods like SMS or personal email accounts. Use role-based access controls, RBAC, and audit logs. 4. Maintain a secure work environment. Work in a private space where others cannot overhear or see PHI. Use privacy screens on monitors if working in shared environments. Lock your screen when stepping away. 5. Handle physical documents carefully. Avoid printing PHI unless absolutely necessary. Secure physical documents in locked cabinets. Shred documents with PHI using a crosscut shredder when no longer needed. 6. Implement and follow a remote work policy. Create formal remote work and security policies. Conduct HIPAA training tailored for remote environments. Require attestations from employees acknowledging policy adherence. 7. Use HIPAA-compliant cloud services. Store and transmit PHI only with services that sign Business Associate Agreements, BAAs. Common compliant services include Microsoft 365, with proper setup, Google Workspace, with BAA, AWS, and Zoom for healthcare. 8. Monitor and audit. Enable logging and monitoring for all access to PHI. Regularly review logs for unauthorized access. Conduct risk assessments periodically. Secure communication methods. And data storage. Secure communication methods. Email. Use HIPAA-compliant email services with end-to-end encryption, e.g. Powbox, LuxSci, Microsoft 365 with proper configurations. Ensure TLS encryption is enabled. Obtain Business Associate Agreements, BAAs, from providers. 2. Messaging and chat. Tiger Connect. OMD. Signal, for some healthcare settings. Microsoft Teams, with BAA and HIPAA setup. Avoid using SMS or consumer apps like WhatsApp unless explicitly approved and configured securely. 3. Video conferencing. Zoom for healthcare, with BAA. Doxy.me, designed for telehealth. BC. 3. Video conferencing. Zoom for healthcare, with BAA. Doxy.me, designed for telehealth, and BC. Secured data storage. 1. Cloud storage. Google Workspace, with BAA and admin configurations. Microsoft OneDrive/SharePoint. Dropbox Business, HIPAA version. AWS/Azure, configured properly with encryption and access controls. 2. Local device storage. Use full disk encryption, e.g. BitLocker for Windows, FileVault for macOS. Enable automatic screen lock and MFA. Store PHI only if necessary, and delete securely after use. 3. Backups. Backup PHI to secure, encrypted locations. Verify that your backup service is HIPAA compliant and has assigned BAA. Test backups regularly for integrity and accessibility. 4. Access controls. Enforce role-based access to sensitive data. Implement strong password policies and multi-factor authentication. Maintain audit logs to track access and changes to PHI. Business associates. Covered entities must have written agreements, business associate agreements or BAAs, with their business associates, entities that perform functions or activities on behalf of a covered entity that involve the use or disclosure of PHI, to ensure that the business associate protects the PHI. And that's it for our video about what is HIPAA compliance. Thank you for watching. If you like contents like this, don't forget to like, share, subscribe and hit the notification bell for more updates.